I'm just going to bring up my two panelists, my two esteemed panelists. I'm Grace Bastidas, Editor-in-Chief of Parents, and we are talking about budgeting for a baby. So I'm also a mom of two, so I know from personal experience that having a baby is exciting and magical and all the things, but it can also be very stressful, especially when it comes to finances. So the first thing you have to do when you think about expanding your family is start to plan your finances and start budgeting. And for that, we have two wonderful, amazing women, two experts, and I'm going to properly introduce both of you. Pamela Capalad is a certified financial planner and accredited financial counselor. She founded Brunch and Budget to help people who felt ashamed or embarrassed about money have a safe and friendly place to talk about it and make real financial progress. Her mission is to make financial planning as affordable as possible for the communities who need it most. She co-hosts the Brunch and Budget podcast and also runs a group financial planning program called Sea Change, specifically designed for people of color. And welcome, Pam.
Thank you.
And we also have Jennifer Meyer. She is a financial coach and founder of Fully Funded, a virtual financial education and planning company. She helps parents and self-employed people create strong financial foundations so that they can reach their lifelong goals. Prior to working in personal finance, Jen was a doula for over a decade and is passionate about supporting parents through the transition to parenthood. Welcome, Jen. So let's get started. We have a lot of questions. So when it comes to finance, how can someone planning to expand their family ensure they're starting off with a steady foundation? And I'll let you, Jen, go first.
Sure. So when families are looking to expand and welcome a baby into their family, I think starting at the basics and doing an overall assessment and overview of their financial standing. So what income is coming into the family? Is there any high interest debt that needs to be paid down? What do emergency or opportunity fund savings look like? How much money do you have set aside for unexpected expenses? So these are ways that people can start to do an assessment of their financial picture and start checking off the checkbox, so to speak.
Okay, that's a big one, looking at your debt.
Yes, looking at your debt.
Pam?
Oh my gosh, y'all. So I have a 3-year-old, and I'm actually in this really interesting stage right now where a lot of my clients who I've been working with, they started off with like, oh, we're getting married, oh, we're joining our finances, and all of a sudden they're like, oh my gosh, we're pregnant, what do we do, right? And I think what's really interesting about this time is it's another huge life change. And so on top of having that foundation that Jen talked about, it's also about, do I need to move? Do we need to own a car now? Do we need to move to a new school district? And I feel like that what's interesting about thinking about budgeting for baby is that you may be spending the same amount of money, but you're spending it on changes. So thinking about, do we need to move, and are we gonna move before we have the baby, or are we gonna move after we have the baby, right? And think about what you want your life to look like in that first year. And I'm gonna tell you right now, it's gonna be really hard to imagine if you haven't had one yet, because no one could have prepared me for becoming a mom. But I feel like that even just thinking about, are you gonna want more space? Are you gonna want to stay where you are? Are you gonna wanna stay in the city? Are you gonna wanna move to a suburb? Are you gonna wanna have a car? Are you gonna be okay taking your baby on the subway? Those lifestyle changes that you might wanna make also have financial implications.
Goodness, the pressure to move or not to move.
I know,
Right.
I know.
I think I stayed in a 1-bedroom for way too long.
Oh my God, my baby slept in our room for like the first 14 months of his life.
So let's talk budgeting. How can you approach your pre-baby budget versus your post-baby budget?
Yeah, so I like to have people do an assessment, like what is your current spending, what's coming in each month, and really getting a sense of where are you at right now. Because from there, you'll be able to make a mock-up and try to make some predictions of things that might change in the future. So to get a good sense of where you are currently in your spending and lifestyle, I think it's a good idea to make categories for where your spending goes, and then do a look back for the past 3 to 6 months and average out those categories, because it's really normal for spending to be variable and different month to month. But if you have averages, then you're able to use that to make some decisions for the future. And then if you're considering having a baby, or if you're currently pregnant and expecting, put yourself in your future self's shoes. Like, where might your expenses change in the next year? If you're looking to bring on childcare, do a mock-up budget of what's going to change in your monthly budget so that you can start to prepare for those changes. And there might even be lifestyle changes, like maybe you're not going out as much with friends, or there might be some changes there. So things that you're spending money on now might laterally move to a different category after having a baby.
So are we giving a brunch then, Pam? I know you're a brunch fan. You have a podcast.
I know, that's the tragic part. At least for a little bit. But I think the thing to really remember is this isn't going to last forever, right? Even childcare, which I would say is the biggest expense to prepare for, because especially in New York City, especially in Brooklyn, it can feel like another rent or another mortgage, right? But it also only can potentially last for maybe 3-4 years. And so I think that, to what Jen was saying about looking at your budget and figuring out what you're trading off on, it may all balance out in the end anyway.
Pam, many of your clients are first-generation immigrants caring for their own parents, right? How do folks in the sandwich generation need to approach budgeting differently when we're preparing this like post-baby budget?
Yeah, and I am one of those people.
You are.
I was born in the Philippines. I moved here when I was 2, and my mother-in-law actually lives with us. So I'm literally living in the sandwich generation. I feel like so many of our clients of color are first generation something, right? First generation in this country, first generation college graduate, first generation with a professional salary, first generation with the opportunity to buy a home. And so what we've seen is that a lot of our clients of color who are trying to have a baby or are planning to start a family are also taking care of the generation before them. So they're really often taking care of parents, they're paying for their expenses. And I think that is going to be the tricky thing in terms of figuring out what you can cut and what you might need to cut back on when it comes to taking care of the generation before you. And also if there's non-monetary ways that the generation before you can help, right? And so, for instance, my mother-in-law who lives with us does a lot of the childcare after school. And so I feel like it really does take a village ultimately. And I feel like that when you embrace the fact that you're in the sandwich generation, you'll be able to make it work, and you'll find ways to do it financially and also non-financial ways as well.
So get the older generation working.
They want to anyway.
If they want, they do. Exactly. So those first few sleepless months after a baby arrives are crucial for bonding with your child and really learning how to be a parent, make that transition into parenthood. But being able to take financial or parental leave isn't always a given.
Yeah.
Jen, how do you prepare clients to carve out this time from a financial perspective, both employed and self-employed?
Yeah. So I'm a huge advocate for paid family leave. Like, the impacts that parental leave has on families is so huge. But we live in the US, so there is no federally mandated paid family leave. So when parents are looking at what might be their leave, if you're employed, you might start with your employer and see, do they have a private paid family leave program? And you'll also look at your state. There are now a few states that have paid family leave insurance programs. So there's 10 states currently, 2 more on the way, and 8 of those states have the ability for self-employed people to actually opt into this program. So if you're self-employed, you can pay a premium and then actually receive paid family leave benefits after having a baby. So that's one place to start, whether you're employed or self-employed. And then the other place to start is planning ahead and financially saving and budgeting for it. So I have a parental leave budget worksheet that I go through with my clients, and it's open to anyone. It's free. You go to learn.wearefullyfunded.com. You can download the worksheet, and it walks you through step by step of what do you think your extra expenses for the leave are going to be, what income might be coming in, and really gets you to a place so that you have a very clear number of what you should set aside to make that leave possible. Because giving yourself the gift of leave, I think, is one of the best gifts you can ever give yourself.
Yeah, and you don't want to wing that. because it's going to
No.
be such an important time for you and your child. Pam,
I completely agree. And my son actually came a month early, so I was able to finagle like an extra month of leave actually and like work out those numbers. I think that one thing that's really interesting that I've seen a lot of my clients do when there's two working people and they have access to parental leave at both jobs is to split the parental leave time. So you have one parent who will stay for the first 3 months, stay home for the first 3 months while the other parent goes back to work, and then the other parent will stay home for the next 3 months. And so you're able to double your parental leave time potentially if your job offers that. I love that you mentioned paid family leave because New York State is one of the states that does paid family leave, and it is actually a really excellent benefit. It covers, I think, 55% of your income for 10 weeks, and the premium for self-employed people is quite low. You just have to stay in the paid family leave program for at least a year and pay premiums into it for at least a year. So if you are planning to have a baby, now is the time. But really, I mean, literally, those first 3 months are such a blur.
It's such a blur.
And I honestly don't feel like 3 months is enough. So if there's a way for you to even work out having 4 or 5 months potentially and giving yourself that gift, like you said, it would be huge.
and you were also saying that if there are two parents that are both taking leave at different points, you're also saving on childcare for that time, right?
Yeah, exactly. I know a lot of parents who have had to put their kids in childcare after 3 months, and it's much more expensive to put an infant in childcare. So if you're able to get that extra 3 months of parental leave, that's a good way to save more money too.
And I find, having worked with parents for over the past decade, it's really emotional too.
Yeah,
Yeah.
it really is. It's really hard to leave your baby that early.
So for birthing parents, there's a bit of a sticker shock when those hospital bills start rolling in. My kids are 7 and 9. I may still be getting some of these bills, not sure. But they do kind of like, they seem never ending. Is there anything we can do to preempt that?
Yeah, so, insurance, y'all. I just had a big sigh because I think if you've had a baby, you've been through the bills, like you said. But the questions that I like to ask insurance carriers in particular, because the thing is, when you get pregnant, that is the time to start getting to know your insurance company, to get comfortable making phone calls with them, and to really start asking them questions. And I like to think about the 3 different times to ask questions, right? So one is like prenatal care, and I've actually seen it where ultrasounds weren't covered. Like my clients were getting bills after the baby was born that their ultrasound wasn't covered. So asking and making sure you're clear on what exact prenatal services are covered and how you can keep them in network so you don't get any of those surprise bills. Because often OBGYNs will bill you at the end of the 9 months. You don't get a bill every single month. You have to wait till the end to find that out. So talking to your insurance carrier early when you first find out is one. The next thing is the cost of childbirth in general. So the cost of delivery, and that varies based on insurance too, and often an insurance company can give you an estimate ahead of time so you can prepare. And I've had clients where the entire bill is covered, and I have clients where they got a $9,000-$10,000 bill at the end. And so when you call your insurance carrier ahead of time, you can figure out how to budget for that as well. And then the other thing is there's postpartum services. So one thing that I found out, and my insurance carrier didn't even know, is that lactation consultants are required to be covered under the Affordable Care Act, as well as breast pumps. But my insurance carrier didn't know that. I had to go to their manager's manager to make sure that my lactation consultant was covered. So I think just really digging and getting to know and being comfortable calling to your insurance company, and also getting comfortable making multiple phone calls, is going to be a way for you to be able to get the most out of your insurance, because this is such an expensive time healthcare-wise.
Yeah, just don't text them. Don't talk to the bot.
Don't talk to the bot. Talk to a real person.
Jen, do you have any tips for, when I talk to the insurance company, which I try to avoid at all costs, how can you get the information you need? How can you understand what they're telling you?
So I think this is an example of how we need to be our own advocates in our healthcare system, right? And calling your insurance company and getting a really detailed understanding of what is covered, what do your benefits include, and what portion you're responsible for is one of the best ways that you can set yourself up to manage your expectations. So definitely call in person, don't rely on the bots, take down the name of the people that you speak to, and start to do research of what providers are in network with your insurance, what hospitals, what birth centers, whatever you might be for your preferences, and start to create your care plan around that. But as Pam mentioned, like sometimes some ultrasounds will be covered, but not all the ultrasounds. So there really is like a bit of a patchwork here. So asking your provider, is this covered? Like, let me check with my insurance. Will help you stay in line with your own like financial vision.
Let's talk about childcare, because no matter where you are in your parenting journey, I think we are all like, we were just talking in the green room about our own childcare situations. So whether you're hiring a nanny or putting your child in daycare, the cost of childcare has gone up. Yeah. How should we plan for that?
So before even having your baby, I think having a sense of what is your work schedule going to be like, and what are your childcare needs going to be? Are you going to need full-time childcare? Will you have a private nanny? Will you be using daycare? Will you need a supplemental part-time babysitter? That's really going to help you in your planning. And then starting to shop around and get a real good estimate of what the price is in your area. So you can ask friends and family who might be nearby, local parenting Facebook groups, and just really starting to make some calls so that you have a good sense of like ballpark. And then I'm a big proponent of making other parent friends. Like, I could not work and parent without my network of parents in my neighborhood. So today, so that could be here today, my son had a half day, and my friend has both my kids this afternoon. And that network of people is just so vital, I think, when you're a parent.
Well, shout out to your friend
Yes,
for letting you be here today, Becky. We see you, Becky. Anything to add, Pam, in terms of childcare? I know you have your mother-in-law.
Yeah, I know. So lucky. I feel like that's a huge thing, is, you know, seeing if there's other family members or friends. This is another thing that factors into lifestyle change. I've had a lot of clients who've actually decided to move closer to family, right, when they have their baby, and that might be a decision that makes sense to make if you realize that childcare costs are not going to be feasible. Yeah. And I think that's something to really stop and think about. And I think too, in terms of when people ask me how much should you save for a baby, right? I feel like researching those childcare costs, multiplying that by a year, that's usually a good baseline for thinking about, okay, this is how much it would be nice to have either in additional income or sitting in the bank.
So I think when we started planning this panel, I joked to both of you, like, how am I going to afford the snoo? You know, which is, everybody knows what the snoo is, but it's like this magical thing that helps your baby fall asleep and costs a ton of money. So I want to touch on baby gear, even though we are talking about the big ticket items today. But there's that expectation, especially if you're a new parent, of like, all right, I need all this stuff. Yeah. Got to get the stuff, right? And Jen, you had some great advice for like, yeah, you don't need all the stuff, and there are other ways to procure things.
Absolutely. So the majority of the baby stuff you're not going to use for that long of a time. Babies grow and change so quickly, especially in that first year. So I like to zoom out and start to look at the pieces of gear that you're going to be using for many years over time. So this might be a crib that converts into a toddler bed. It might be a car seat. It might be, for us New York parents, like a really sturdy stroller. And these might be the items that you want to invest in. But there's going to be a lot of items that your baby just grows out of so quickly, like the seats the baby sits in, and baby clothes, and all the accoutrement of those first 6 months. So those things, I am a huge proponent for buying secondhand, hand-me-downs, asking local neighborhood parent groups. And it's also environmentally friendly too, to reuse those items that may have been used for 8 weeks, tops.
And we shouldn't get that hung up on these items. When we're talking about budgeting, I think people's minds may go to those the gear, things. But that isn't really the most important items.
It's not. And I think so, one, if you're on Facebook, every neighborhood has a Buy Nothing group. And there are so many parents on those Buy Nothing groups just giving away free stuff. That is like 2/3 of my son's toys and clothes are from a Buy Nothing group. But the other thing that I would say is, like, can we normalize just asking for money at baby showers, please? Like, there were
Let's do
so
that.
many things. There were so many things that I got that I didn't need. My son did not like the bouncer or the rocker or the bassinet. He would only sleep when he was sitting on us for the first 2 weeks of his life, right? And so we ended up selling our bassinet, and we ended up giving away like half of our baby gear that we thought we were gonna need. And I ended up like on Amazon every other day buying stuff that I actually did need. And I feel like if we can figure out how to get out of the baby gear mentality and just like ask our friends what we actually need, and sometimes it's just money because you're not going to know what you need until you're actually there, then I feel like that we would also be in a better place when it comes to like finding the next baby gear.
Let's normalize that. I love that idea. I can't go back and have another baby shower. So I've paid off my debt. I've got my childcare sorted. I've checked all the boxes. Is it time for me to plan for my child's future? Do I need to save for college at this point? Pam.
Oh my gosh, I have so many thoughts on this. Well, first of all, I will tell you, I've done the math on like how much it would cost to send my son, who's 3, to college. It would cost $500 million to send him to undergrad by the time he's 18. So he's probably not going to college if it costs that much. I'm going to be real, right? And the thing that, because I work with so many clients in the sandwich generation, the thing that I found is they have been told by their parents that, hey, you're my retirement plan. And I think the biggest gift that you can give your child is to make sure that they're not responsible for your retirement. So if you're in a place where you haven't topped up your 401k, you haven't maxed out like all of your retirement benefits, that you haven't been able to save for yourself, it's okay to wait to save for your child. It's okay. Because if you don't take care of yourself, then at some point your child is going to have to take care of you. And I've seen clients who are on the other side of that. And so I know it feels weird. I know it's hard because when you see that child, you just want to give them literally everything. But if you can figure out how to take care of yourself first, then you can start planning for your child's future at that point.
Gosh, that's so wise.
Yeah, absolutely. So planning for your own retirement first, because whatever your child's educational or like start into adulthood ambitions are, there's loans for that. But unfortunately, there are no loans for our own retirement. So as Pam was saying, planning your own retirement and making sure that you're set in your elder years is one of the biggest gifts that you can give to your kids.
I love that, the gift of not having to worry about you.
Yep.
And they could pay for their own college, right? Maybe? Take out a loan. Let's talk about estate planning. The estates must be planned. What should we consider at this point in the parenting journey? Like, do we have to think about, who's getting what and life insurance and all that?
So I'm gonna confess something.
You're amongst friends,
I
Pam.
know, right? I'm like, so we are still working on our estate plan. And I say that because even as a financial planner, this is a hard thing to think about, right? And like, I know, and I tell this to all my clients as soon as they have a baby, set up a will so that you have a guardian for your kids in case something happens to both of you, right? And I will tell you, like, coming up with like the primary guardian, the secondary guardian, the tertiary guardian, trustees, executors is just like, it has literally been like a 2-year process for me and my husband, And so yes, it's absolutely important, and please start thinking about it now, and also forgive yourself if it ends up taking you a long time. Because we still have like literally one more thing to give our estate attorney before we can finish our documents, and then we can do it, but it's the kind of thing that will take months and potentially years to think about. The most important thing is to make sure that at the very least, you can go on a website like LegalZoom, get a will, and like name guardians for your kids in case something happens to both parents.
It's such an emotional thing, which
It
I think
really
is the
is.
reason people put it off.
Yeah, and they tell you like, don't put anyone on there who's like older than you. So like,
Right.
So-
Because oftentimes if your parents are alive, it's like, yes, I want grandma and grandpa to be the guardian. And it's often recommended to not put someone older than you, and then it's really hard and emotional decision.
yeah.
All right, so let's say the baby's here. The baby has arrived. Is it ever too late to get these things in order?
Never.
No.
Okay.
And these
Never.
are things people are going to be working on for the rest of their life. So you're going to pick up wherever you're at in your process, wherever you're at in your financial journey, even if you already have kids. So any time that you can start is a good time to start.
Yeah, I like to, my husband always says this is something the environmentalists say is the best time to plant a tree was 20 years ago, the second best time is now, right? And I feel like that there's so much shame and fear and embarrassment around finances about all the things that we wish we did in our 20s, or the money we should have invested, or the money we should have saved, or I should have prepared more, I should have known this. And I am very guilty of that. I am very guilty of being like, I should have known better, right? And right? Yeah. And the thing is, like, you know now. And if you know now and you're still not ready to take that step, that's okay too. Because when you're ready, you'll be able to do it.
I love that. I think when I talked to you both, I was confessing all my financial sins because there is a lot of shame about not having it together, especially if you're a parent, you're this responsible adult, but yet, well, I haven't done that.
I know. They just like hand you that baby after 2 days and they're like, good luck.
Maybe we can all think of ourselves as a work in progress.
Yes.
Yes.
Excellent. Is it time for questions? I don't want to miss our Q&A time.
Well, I have a question.
Oh,
This
boy.
was great information. I wish I could have had this panel before I had my kids. However, still good information as they're growing up. So as an OBGYN, one of the common questions or actual disbelief moments is actually that thing about insurance. How that works, again, getting bills after the baby is delivered. What would you say are the top maybe 2 or 3 things that physicians or healthcare professionals could message to their patients about budgeting in a very quick way so that there's not the sticker shock that I would say 90 to 95% of patients have with the pregnancy portions and also the delivery. And if that delivery plan changes, so say, there's anticipation of a vaginal delivery and then they switch to a C-section, that does change the cost significantly based on what policy they have and deductible. So what would you say would be good from a healthcare provider perspective to share with their patients on what you were discussing?
Oh, I love that question.
That's such a good question. I think starting in those early prenatal appointments, and maybe it's a checklist in the client file of check in with your insurance, have a really good understanding of your benefits. Some insurances, I've had clients who haven't paid a dime for their whole delivery, however it went. And then other folks, they'll be responsible for their deductible and then a percentage, is it 20%, 10% of an overall bill. So for people to get a really good understanding of what their potential they might need to pay, but then again, if they're gonna be owing a percentage of the total bill, that's really impossible to predict in advance. And a lot of people might not know about HSAs. So these are the health savings accounts. If they have a high deductible health insurance plan, they'd be able to utilize an HSA to save tax-free dollars towards their deductible, towards health costs. There's a whole long list of things it can be applied to, but that can be helpful for folks in that situation.
Yeah, I love all that advice. That's so great. And I feel like that the only things I would add to it are if you could give your patients an idea of like a range of the dollar amount to potentially expect, because I feel like the doctors will know more than anyone like what kind of bills they send out. So having that dollar amount just to have in people's heads, I feel like that surprisingly it gives people a lot more peace of mind to know the number instead of being surprised by it. And the other thing I would say is like any pitfalls or common pitfalls that you see in terms of like coding or billing that they might run into. Like, I imagine that like, making sure that like the ultrasound provider, who's usually not at the OBGYN, is coding it properly and figuring out how to partner with the patient a little bit more on that side of things. I think medical billing and medical coding is what leads to a lot of bills and what leads to a lot of huge surprises in general.
That's great.
And we do actually have one question from online. They're asking, is there a certain amount of money that we should aim for to save for a baby?
Oh, it depends. I'm sorry, that's a CFP AFC answer because it really does, right?
Is it one size fits all?
Only onesies are one size fits all.
But a lot of it's going to depend on current expenses, lifestyle, current bills and responsibilities. And I think that's why it's so important for folks to do their own personal audit of what does it really take for their household to move forward each month? What does it take for you to stay on track with your financial goals, if that's lifetime savings, retirement, all of these things? So getting a clear financial overview in advance is really going to give you the best picture. And then if you have to supplement or prepare for taking a leave of income, so if you have an unpaid leave, then doing some math and dividing out how much each month you're going to need to have in savings to supplement the cost of living.
Yeah, I feel like the back of the envelope answer is what are the biggest expenses that you anticipate, right? Childcare, moving, so increased rent if that happens, potentially another car payment if that happens, and then just like an estimate of like, the thing I think about is like diapers and like clothes every month, right?
Diapers.
Because, yeah, diapers, clothes, and potentially formula.
Potentially formula.
Yeah. Yeah. So, and I think if you just focus on those, then all of the other stuff is like not as important to plan for.
So there's not like a percentage per se that you can say, save this much from your salary.
It's
No.
all situational.
Yeah, it's all situational. It's all going to really depend on like we didn't have to pay for childcare for a certain number of, right? But we moved. So it's so different for everyone. And we also didn't plan to move. It just had to happen.
So we have one more financial question for you. Sorry, guys.
No, this is great.
Love 'em.
Somebody's asking, what about planning for less traditional methods of becoming a parent? Adoption, surrogacy, what should they expect both expense-wise and planning-wise?
Yeah, so non-traditional ways of becoming a family, the cost can add up. So if we're looking at adoption, IVF, surrogacy, it's going to be looking at what are the top item costs and starting to plan around that. And then are there any creative ways to either cut those expenses or get some benefits? Because some employers will have IVF as a benefit, and there might be other ways that people might be able to creatively solve for those additional expenses.
Yeah, so for things like IVF or surrogacy, you may be in a situation where your healthcare provider will allow you to take out a medical loan. So for instance, do care credit or something like that, where you have 0% interest for a certain number of months. And that's an option that a lot of my clients have taken because they want to have the baby in a certain time frame, and IVF is out of their budget at the moment, but they're able to make those loan payments. And so it doesn't necessarily have to be money you have in the bank either. When it comes to adoption, that's when it's time to talk to an accountant, because there are also a lot of tax deductions when it comes to adopting that an accountant will help you be able to think through so you know what that final number might be and what you might owe.
That's a great question. And then with any scenario, you still have to think about childcare and
Yep,
all
of
the
that
rest
stuff
of
too.
it.
And then, well, we have a few minutes left here. Is there anybody here in the live audience that has any questions for our panel?
You have a brave soul over here.
Got to.
So my question is, among clients you may have worked with or people you talk to who do the budgeting before the baby comes, what are the biggest surprises, either things that were more expensive or less expensive?
That's a great question.
Yeah. I think that, I know we talk about childcare so much, but I think that's the biggest sticker shock for people.
Really is.
I think people don't anticipate, and I will say especially in cities and especially in New York, you don't anticipate how much it's going to cost. And also, you know, whether you go with the nanny route or the daycare route, I think that there are decisions that you're surprised you end up making on either end that we found with clients too, where they thought they were going to go one way, but they decided we definitely want to go the other way. And that's another thing that you have to account for in the budget as well. But childcare is huge. And honestly, like, the random stuff that you end up buying, I don't even remember all the random stuff I ended up buying. But like literally I felt like I was on Amazon every day just being like, oh, I needed this and I didn't know. And I think those costs tend to add up and creep up in the first like 3 to 6 months until you find yourself having a rhythm. So when you come up with your budget, it does often help to pad it a little bit, right? And to maybe add a couple extra $100 to that budget every month.
Yeah, and I think for first-time parents, it's a transition in lifestyle. So I think one surprising thing is how many modifications might need to be made to the home in that first year to make it safe for a toddler who's crawling and pulling up on everything, and eventually a small child who's walking around and getting into everything. And once you have your household like baby-proofed and established, for additional children, you might not have to make so many changes. But that first initial year, there can be a lot of modifications around the home that can be surprising. So it might be changes in furniture or moving everything up higher on shelves or adding more shelves. So I think that can be some surprising elements.
Oh, we have another question.
So I don't have any children yet, but I would like to. And I know it's open enrollment coming up soon. And so I'm just curious if this is a good time for anyone who is thinking about having children in the next few years. Would it be good to consider your health insurance plan and potentially changing it if it doesn't have good benefits for what you may need it for if you do get pregnant and have to go, to an OBGYN that you haven't really had to go to in the past several years?
Can we pass that question to Carolyn, who had an amazing answer to that in the green room? I don't want to take her answer.
We're
Yeah, so it's really one comment that I've made to, I guess you'd like for me to have the
I learned something in the green room just now that is like
So when
exactly
people are
the answer to
thinking
your
about
question.
getting pregnant, it's really good to think about when are you going to get pregnant. A lot of people now have high deductibles, and if you have a pregnancy over 2 years, 2 deductible years, you're going to pay double. So I actually recommend people to start getting pregnant in November. So don't get pregnant, but because your first visit is at 6 to 8 weeks, and so January 1st is your first prenatal visit or postnatal visit. You're pregnant now. You have the baby August, September. You've got those first few months when you've got all those baby checks, and then you're done. And so that can save a lot of money. It's sad, though. I don't want to overwhelm OBGYNs from August through December, but that's, our crazy healthcare system requires that sort of planning.
Thank you. Sorry to put you on the spot. I was just like, oh. In general, I would say that when you're actually trying, definitely switching, if you have the option, from high deductible to a low deductible PPO, switching from an HMO to a PPO, so that if you need to see a specialist, you don't have to go through your primary care physician first. And also it'll definitely keep those costs low. So even though your premium is going to be higher, you are going to have less surprise medical bills if you're in a higher health plan.
We talked about surprises before, and is there one thing that your clients both tell you, oh, I thought I was eligible for X, Y, or Z? Is there a misconception that you find that a lot of people have when they're entering into parenthood?
One misconception that I find often as people are preparing to become parents or are pregnant and are looking at their benefits is really a big surprise that there is no paid family leave, there's no paid parental leave in the U.S. as a whole. And that is really shocking for some, especially when they learn that FMLA is 12 weeks of job security. You won't lose your job per se, but you don't get paid, and that's only for employers with 50 or more employees. And that is one thing that people are continually shocked as the years go on.
The safety net.
The safety net, that there's no established safety net, except for the current 10 states and 2 more that are adding it to as a benefit.
Yeah, I would totally agree with that. I feel like childcare is one of the biggest issues that we're dealing with right now, and I think we really saw that come to light in the pandemic, and I think it really revealed that huge crack. I am really excited that there are places who are addressing it. I know in New York City, they just announced childcare for all. So I hope that these 10 states, and I hope that cities like New York act as models and serve as models for making childcare more accessible and less costly.
So as we wrap up, is there one big tip you can give to our audience that if they do one thing, if they're planning to expand their family and they have this inkling of an idea of like, yep, let's do this, what's the one thing they can do today? Baby steps.
Oh my gosh, I'm like, one thing, so many things ran through my head. I would say the one thing that you can do is relax.
Take a breath.
Take a breath, prepare for the unexpected. I am someone who's a huge worrier, a huge preparer. It's why I'm a planner. And I wish that more people told me that, right? I got so much advice coming at me and so many people telling me things from so many different directions. And I think that ultimately, like, we all end up figuring it out. And so I think enjoying the time that you're pregnant, enjoying those first 3 months, and planning to enjoy those first 3 months with your baby is the best advice that I wish I could have gotten.
Yeah, I think everyone's going to figure it out, and no matter where you're at in your journey in terms of planning to have kids, currently having kids, where you're at with your finances, take a breath, relax. You're going to figure it out, and then do just the next step on your list and then keep going, because this is like lifelong things that you'll be working on. So just keep your momentum and choose a pace that isn't going to burn you out and that you can work on consistently.
And if they need help figuring it out, you're at fullyfunded.com.
Yep, wearefullyfunded.com and at wearefullyfunded on Instagram.
And Pam,
Yep, and
plug.
Yep, thank you. At Brunch and Budget on Instagram and Twitter, and then brunchandbudget.com.
All right. Do we have any other burning questions in the audience or virtual?
We actually had one more online. Somebody wrote in saying that she has her own health insurance plan. Her husband does also. Her husband's plan is a little bit better. Should she just drop her plan and go on her husband's, or should she stay and have both of them, basically?
Oh, good question. So the thing to think about is, the thing that I've seen is often can be cheaper to stay on each of your plans, because adding a spouse or another family member is actually more expensive than what it costs to just insure the employee. So a lot of employers will cover like a lot of the premium for the employee, but might not cover as much for the spouse. So you really need to look at what the actual premium payment is going to be at the end of the day and decide from there.
Yeah, so compare and contrast the premium, like how much it's going to cost, and then the benefit, what you'll get in return potentially.
Yeah, but you can decide which insurance you want to put your child on. So it can be either spouses, either parents.
Just make that phone call.
Yes, make that phone call.
Within 30 days.
Yeah.
I think our time is up. Thank you so much, Pam and Jen. So much great advice. Thanks, everyone.